Hey Savvy Social Workers, I am coming to you with this video because I wanted to explain how to answer the different types of questions on the exam. So knowing the units of the questions is an actual leg up in helping you to understand and answer the question a lot easier. So as you begin to practice and you start getting strategy down and you start learning the content, one of the things that I suggest that you start doing after you are comfortable with that is start looking and trying to identify which which units the questions are from, okay? Because this is going to help you understand how you need to answer. So here is a little key of what is most common for the ASWB exam. This is not absolute, this is not all inclusive, this is just what is most common. So what that means for unit 1 here, you're going to see a lot of most questions, okay? And it's going to be a lot of content reasoning and some recall. So what that means in unit 1, when you're practicing and you're learning the content, this is an area where content recognition is very important. But not only is it important for you to be able to recall, but a lot of the questions are for you to be able to reason with that information. So I am going to show you an example for each of the units, but just knowing that this is where you're going to see a lot of your what is most likely this, what is most likely that type of questions. Now, most questions are a bit more difficult for you to answer because these are the types of questions where they will put several correct answers and you have to prioritize them by level of importance to answer which one would be the most likely. Okay, so just remember that you're also learning how to answer most questions in this unit as well. So remember, it's content reasoning as well as some recall of the information or the content that you're studying. So when you're studying this, don't just study it to memorize the content. Actually study the content to reason with it, to know what the content manifests as. So that could be in regards to the stages of development, anything like that. Don't just say, okay, I know this chart, I know these ages that match this stage and all of that. Know what the stages manifest as, what they look like down the line, what they look like if they are successfully and unsuccessfully completed. Therefore, when you see the question on the exam and they're giving you a scenario of maybe somebody that's struggling in a stage down the line, you will be familiar with that. One key thing I would suggest to help with that is creating examples, and I would say personalized examples. So examples that are personal to you, making them relevant to either people you know or situations that you've experienced in your real life to be able to retain and recall as well as reason with the information in this unit. Unit 2, this is the assessment unit where you have for the master's level, it's just for bachelor's and master's, it's mainly just assessment questions, but also for the clinical, they're adding, diagnoses as well as medications. And the master's level will probably have medications as well. So this is where you also see a lot of the first and next questions as well as most questions. However, there is a significance for these types of questions where you need to focus on signs and symptoms. Okay, so when you're reading these questions, they'll either usually specifically tell you you're in an assessment, and they will give you some signs and symptoms of something because you cannot assess or diagnose a client without paying attention to the signs and symptoms. And if you want to add on to that, I would say signs, symptoms, frequency, and duration. But a lot of times they don't always give the frequency or the duration. But anytime they do, you want to pay attention to that as well. Always pay attention to time frames in all of these questions, no matter what. But this is where they will usually be asking first and next and most. I'm also going to provide an example of a unit 2 question as well so that you can see what that looks like when I say pay attention to the signs and symptoms, because your answer is going to be dictated by those signs and symptoms that they're giving you. If they're asking you for a specific diagnosis, then that means you have to look at the signs and symptoms which were presented in order to come up with that diagnosis that they're asking you for. If a client comes in exhibiting certain symptoms, then you need to know what are these symptoms indicative of, what are you going to be assessing this client for. So this is how you should be looking at Unit 2 questions to study for them. Unit 3 is your interventions, case management unit, and this is where, of course, more of the application intervention questions are. And so they're asking you, what should you do first and next? And then here they will throw in some best questions. What's the best thing to do in this situation, that situation? And so Unit 3 questions are primarily based off of situations, specifically the priority situation in that vignette. So you have to make sure that you are knowing the difference between a question that is giving you signs and symptoms to prioritize or a situation to prioritize. That's the biggest difference between units 2 and 3, even though they're both asking you the first and next as well. Now, unit 4, the professional values and ethics, professional relationships, and all of those things. This is where you're going to get a lot of your should questions as well as your best questions. What's the best thing to do the social worker should, or what should the social worker do without them adding first or next? And so this is a lot of content recall, but it also does consist of content reasoning as well. However, these questions usually give you a dilemma, and you have to be able to recall what the code of ethics says in that given dilemma. If it's not a dilemma that is specific in the code of ethics, then I tell people that that's when you think of what is the best practice. And when you think of best practice, that is in regards to doing what is best for your client. Now, keep in mind, you could very well just see a should question in Unit 1. I'm not saying that you won't. This is just the most common. You could see a first question in Unit 1. You can see a next question for Unit 1, but you won't see a lot of them. It's the point of this. So again, this is just the most common types of questions that you will see for each unit, okay? Not absolute. It's not that I'm saying you will never see a first ethics question, because you could possibly see, but the majority of the questions are based off of should and best. So here's just an example of what a Unit 1 question could look like, okay? And remember, this is where you have a lot of the most type questions. A family is referred to a social worker. The mother says she is constantly tired from going to work, cooking, cleaning, running the household, and caring for her first child. Her spouse is angry with her for not spending time with him and for not keeping the baby quiet. The couple most likely is. Okay, so out the gate, we know that this is a family, so that is going to be our client. And it says is referred, so this is the beginning of the helping process with this family, because this is a referral. So we know what the mother says, and then it also tells us what the spouse says. So because this is a family, we want to prioritize what both of them say or how both of them feel. We don't want to pick one over the other. And so the question also is asking you about the couple. And they're saying the couple is most likely, couple most likely is. So you're going to pick based off of the content in this scenario. They want you to reason it, to understand this content enough to reason with it, to know what may this be indicative of? Is this couple having difficulties with the new life cycle stage? Are they struggling with serious family of origin issues? Are they demonstrating the need for in-home support services? Or are they putting their baby in danger? Okay, so you would have to just be able to reason with the information. The information given here is basically she's constantly tired. She's working, cooking, cleaning, running the household, and she's caring for her first child. It doesn't say how old the child is, but down here it lets you know that this is also a baby, okay? So in this case, it would be that they're most likely having difficulty with the new life cycle stage, because it appears that she is now having her first, they have their first child, and she's busy doing all these other things, and now she's not able to spend as much time with him before the baby came, and she's having a tough time maybe keeping the baby quiet. So this would be them having difficulty with the new life cycle change. Again, this is me reasoning with that, just kind of taking the information that was given and reasoning. And see, this is not a recall question. This is not anywhere where they're going to specifically tell you in the book, this is the answer you look for this type of question. You have to reason with the situation. And so that's what I mean when I say Unit 1 is primarily asking you to reason. Now, they are going to ask you some recall questions, but a lot of them will be reasoning. The rest of these answer choices really have nothing to do with the situation at hand, with family of origin issues, demonstrating in-home support services. Actually, that one could be something that they, could most likely be demonstrating. But we want to do the most likely. And remember, I told you when you have a most question, a couple of them could be correct, but you have to put them, prioritize them by level. And so this one would be more important, or most likely than C. And then putting their baby in danger is, I don't see anything in here where they're putting their baby in danger. So it would definitely be between A and C. And when I'm looking at which one is most likely, it would be that they have a new life cycle going on because they have a baby. It's their first child, and she's trying to juggle it all, and he's not used to that as well. Now, this is a Unit 4 question, and this is just basically showing you what a Unit 4 question looks like. You can take your time and go through this question, but just understand that if it's a question that doesn't ask you anything specifically from the Code of Ethics, then you should just be focusing on what's best practices. And like I said before, best practices is what is best for the client. So in this case, you're a social worker in private practice seeing a client who has not paid her for many weeks. Whenever you brought it up during the last session, the client breaks down and says, he doesn't think that he can go on. So this is a troubling statement. So you want to do, it's what is the best thing for the client in this situation. But this is also something that the Code of Ethics speaks specifically on. So you would have to know what it says in the Code of Ethics about when a client can't pay, yet they still need services and things like that. So you're looking to do the most ethical thing. As you can see, it says, what should the social worker do? And it doesn't say first or next or whatever. So we're looking at the most ethical thing to do, and or what is the best practices. And when we look at best practices, that is, again, in the client's best interest. So the answer for this one would be A. And you can look at this and break it down. If you need to pause the video, whatever, I'm just trying to give you brief examples. Now, here is the nitty-gritty of what I really want you to understand, the difference between a Unit 2 and a Unit 3 question. Like I told you before, Unit 2 is based off of signs and symptoms. So I've already broken this one down, and I just basically want to show you how this one specifically tells you that during the assessment. So whenever it tells you you're in assessment, you automatically know that that's a Unit 2 question, unless it says, what should the social worker do next, and then it takes you into the next phase. If it says after completing the assessment, then it's taking you into the next phase. In this case, you have a social worker who was referred by the nurse, a client who she observed significantly changed behavior compared to her usual presentation. So she came into the cancer center acting differently than she normally does. So now you, the social worker, you did the assessment the same day, and you know that the client seems distant, absorbed, and noticeably sad. So what would be the most important thing? Remember, first means most important thing that you would do according to these signs and symptoms. So this is where I always say that you consider the presenting problem, you consider the whole situation, but you focus on the priority problem. So considering that she was referred to you because she's not being her usual self, and then you assess her and you notice these things, what would be the most important thing you would want to check for first? You want to, it says assess, so what would be the first thing you want to assess for first? And so, of course, we're in an assessment, we want to gather information, so your answer would be having to gather information. And so the only one here, or the main one here that would be the most important, would be to see if anything has changed. Since this isn't her usual presentation, she usually comes in a bit more happy or whatever the case, and now today she's different. Let's see if she's had any changes in her situation. And lastly, Unit 3 question is where they will give you a situation. Now, Unit 2, as you can see, they gave you specific signs and symptoms of what was going on. In this situation, in this vignette, they'll give you a situation, and then you have to pick the priority out of the situation and base your answer off of that. In this case, it's telling you that you're seeing a client who identifies herself as a Christian. She tells you that, she's pregnant, she's considering having an abortion. That is the priority in the situation. The question gives you a snippet that says, in response to the client's request. Well, the client's request is that she would like to get guidance from her pastor about the decision. So what is going to be the most important thing you're going to do in response to that request? And that is going to be D. I basically just wanted to show you an example of what a situation looks like versus what a Unit 2 question where they give you assessment, what that looks like. So I hope this video was helpful in showing you how to understand how to answer each unit of the questions. Let's continue to get those passes the savvy way.